socialized medicine invading the American medical system under Obama and Pelosi. There are still many questions on how, if at all, this can possibly work. In a recent article in the Wall Street Journal, the president of the Galen Institute, Grace Marie Turner, said we can look at Romney Care as an example, and the outlook is not good. Now she joins us to talk about this article. Grace Marie Turner, welcome to the Savage Nation.
Hi, Michael. Thank you so much for having me on today. It's really a pleasure to talk with you and really important, I think, to be talking about health reform at this crucial time. Thank you so much for this opportunity.
What is it about Romney Care that is similar to Obamacare?
We really are going to be able to get a preview, I think, of how Obamacare would affect the country by looking at what's happened in Massachusetts. You know, we talk about the states being laboratories for democracy. Well, Massachusetts passed many of the provisions in the Obamacare plan, and we've now had 3 years to see how this is working out. It was passed under former Governor Massachusetts Governor Mitt Romney in 2006, and he said on Fox News Sunday recently that this is the ultimate conservative plan. Well, that's causing him a lot of trouble with conservative voters who see that the architecture between Romney Care and Obamacare is very, very similar. They both have an individual mandate that requires people to purchase health insurance, defined by the government or pay a penalty. Businesses are required to participate or pay a fine. They both rely on government-mandated purchasing exchanges that also provide a way to control private health insurance. Many of the uninsured are covered through an expansion of Medicaid, arguably the worst public health insurance program in the country. And there is a huge plethora of new government boards and agencies. Both of them require this same kind of architecture. And for Romney to say that the Massachusetts plan is the ultimate conservative plan is going to make it very hard for him in the 2012 elections, in primary elections, if he does decide to run for president, to say that, that Obamacare is a completely different thing. He's not going to get away with that in a primary challenge. He might be able to get away with it in speeches, but not when he's trying to argue with people like Mitch Daniels or others who see the truth of what's happened in Massachusetts.
Well, what happened there?
When you look at what's happened in Massachusetts, it tells us we should not be even thinking about going there. When you look at some of the things that they've done to increase the number of people with insurance, about 2/3 of the people who are newly insured are insured because they've either gotten free government insurance or heavily subsidized insurance by the taxpayer. So it's hugely costly. The treasurer of the state of Massachusetts, a Democrat, said this week that the bill and the plan is about to bankrupt the state. They can't afford it. We also see that costs in Massachusetts for health insurance are higher than any place else in the country. The total annual cost for health insurance is about $14,000 a year, and spending in Massachusetts is 27% higher than the national average. So Massachusetts has not achieved what the goals that people say will happen if we have national health reform, that health insurance will get cheaper. It's gotten more expensive, not just because Massachusetts is expensive in its own right, but most people argue because of the Romney Care plan. And they also said, what'll happen is that we'll find fewer and fewer people have to go to emergency rooms to get their care, and therefore we'll save money there. Well, not true. The hospital emergency room visits are 7% higher after Romney Care went into effect than they were before. And the great majority of the people are going there because they can't find a private doctor to see them. The Massachusetts Medical Society recently did a survey, and it found that 56% of family physicians, internal medicine physicians, are no longer accepting new patients. The average wait for a doctor's appointment is about 44 days. So people are going to emergency rooms where it costs a lot more instead of going to see a private physician because they can't find one to see them.
Oh, my God.
So to say that we didn't do what President Obama is doing, which is what Mr. Romney has said, putting the government in charge of our health care. That's exactly what they did. And what's happening is what the next phase of Romney care is that the governor is now about to put price controls on health insurance. The health insurance, 3 out of 4 health insurance companies, only 4 health insurance companies left in the state of Massachusetts, 3 of 4 of them lost money last year. And they're saying they can only stay in business if they raise their rates this coming year. They want to raise them again up to 40%. Well, the governor's saying you're not going to be able to raise them more than 5%. So what's going to happen? They're going to start deleting services. They're going to start paying doctors and hospitals less. There are a number of hospitals, safety net hospitals, that treat a large number of indigent patients that find that they're on the verge of bankruptcy. Well, this is going to make it even worse if they're going to be paid, either the payments are stretched out or they're paid less. So we're seeing the next step is government price controls and restrictions on access rationing, which is exactly what we see in European countries that have tried to do the same thing. When government gets involved in trying to control our health sector, it gets it wrong. We see this has happened in Massachusetts, and this is an absolute preview of what will be happening if Obamacare becomes the law of the land.
Grace Marie Turner, thanks for being on the Savage Nation.
Thank you, Michael. It's really a pleasure to talk with you. Thank you so much for this chance to talk with you and your audience, and I hope you'll have me back again. If people want to know more, can I ask them if they would visit our website at galen.org or our aggregation website to learn a lot about what's going on in the health system, not only just what the healthcare debate, not only what we're doing, but what others are doing at Health Reform Hub.